gonna go ahead and start today's conversation with a question about the early signs and symptoms of psychosis and some of the signs and symptoms of psychosis maybe that are missed or misunderstood, and perhaps some that you've observed in loved ones and or experienced yourselves. So who would like to start?
I can start. When I was first diagnosed, I feel like after I was diagnosed, I started thinking about my earlier life and like living as a kid, and I feel like there were definitely symptoms there that no one picked up on, because no one's gonna look at like a 10-year-old and be like, this kid has schizophrenia. But there were things like I thought I had really, really good hearing. I thought I had amazing hearing because I would hear things that other people didn't hear. And I would hear trains coming in the distance when we were in like the middle of a park. And I'd be like, guys, there's a train coming. And everyone would be like, I don't hear a train. And I'd be like, well, that's because I'm good at hearing. So just small things like that. And that were never really caused that many problems in my life until it really got bad when I was about 16. But there are definitely things that I feel like more people could have looked into and been like, I wonder why she thinks that she can hear things that no one else can hear, or that she sees things that no one else can see, things like that.
What were some of the reasons that people had for you that those things were happening?
I don't know. Actually, I think most of the time when it's like a 10-year-old, they just write it off as a kid. They're just like, it's just a kid being a kid. They're just doing kid things, which makes sense because kids are confusing, especially when it comes to psychosis. There's a really weird line between like being a kid and then having psychosis. It's a really hard line to find.
And the difference between creativity and imagination versus,
Definitely. It's hard.
For me, it was not me, but both of my caregivers. One would talk to a guy who used to come and visit him, and nobody saw the guy but him. He would also have people who would come and visit him at night. And stand in the window to talk to him. And those were the people in black who would come and take him away. And then the other caregiver, we never really understood why she was really, really happy and boisterous and bubbly all the time. And then sometimes she would be in the house for days and not talking to anybody, or why her relationships with friends never really lasted, why she couldn't maintain friendships, sometimes even jobs, because something would happen. And the community wrote it off as her just being like this really, really nice person. Like, oh my God, she went and bought groceries for all of us. Or she went to the store and caught a sale and she's bringing all this meat to us. She's such a great person. She's a giver. And she really is. I think that's where we got our spirit from. But underneath that, especially as a child, we didn't understand that she was spending all of her money to buy these groceries and make bags for people in the neighborhood because she thought the world was ending. And so, again, in the Black community, she was very religious, but that's just something that we do. We praise God. We pray for each other and with each other. But hers came to the point where she would think that she was getting messages from the TV. And those people were talking directly to her because she was the messenger and she was sent to do God's work. So those were the signs that we saw early on, but again, we didn't know what it was.
I think one thing that really it makes it easy for people to dismiss signs of psychosis is when someone they seem all right. And like, for example, me, I'm a very put together person, and I don't look like I have psychosis, but you can't look like you have psychosis. That's not a thing. But there's a lot of stigma around schizophrenia and psychosis. And so when people think of it, that they have an image in their head of someone who is falling apart and very obviously falling apart. And so it's really easy to look at someone like me and be like, well, you're functioning and you're talking. Actually, when I was admitted to the psych ward and I spoke to the doctors in the psych ward, they said that I did not have psychosis because I could say complete sentences. And I was like, wow, that's the line we're drawing here. Okay.
With me, it was more like hindsight moments. It was after education, you know, becoming a social worker and learning about mental illness. And then it was like, oh, this what was happening to me. And then I started diagnosing everybody in the family. Like every time I learned to do new diagnosis, like in school, I was like, oh, this that person. Oh, this was, you know, it's something that we can laugh at now. But like you said, like in the African American community, like growing up in the 70s, 80s, and 90s, and even still today, even with now more education surrounding mental health, but it was still those things that we just identify those people or ourselves as just being, you know, quote unquote crazy. Yeah, it was like, you know, oh, that's just them being crazy or they tripping, you know, how they go off and stuff. And we normalize their behavior because of the lack of education, because of the lack of knowledge and the avoidance of the stigmas that's placed on individuals that have psychosis moments, and not really knowing what to do with that, but to, like you say, let's just pray it away because God fixes everything, and we just assume that this is how it's supposed to, you know, go. Like we can go to the doctor for physical health, but you better not go to the doctor for anything relating to your mental health in our community, because it was like that stigma, that shame put on you. Nobody wanted that. Nobody wanted to be diagnosed. Nobody wanted to be viewed, you know, by others as something was wrong. So most people accept that, yeah, I'm crazy, my nerves bad, I'll go off. You know, like, yeah, I'll go off if you mess with me. Like, it was easy to accept that versus accepting a diagnosis. That's what I just saw in my community. But like I say, hindsight, even it was like those hindsight moments for me, just being able to identify what I was experiencing.
With the work that I do, typically it's a referral coming from a family whose loved one has had a full-blown psychotic break. And that is the moment at which then they're hospitalized and hopefully treatment and care is initiated. But I find that usually when I'm talking with families, they did notice symptoms long before full-blown psychotic break, or maybe it was a brother or a sister coming to the family member to say, Mom, there's something wrong with Johnny, you know, he's just not acting right, and the parents might have missed it because they're busy, they're working, whatever. And so, you know, being able to get a person help when they're just sick, right? To have to require them to become so sick that they exhibit danger to self, others, or, you know, really gravely disabled. And when we talk about grave disability as a criteria for involuntary commitment, and it, you know, that's even aside from voluntary, going to for help voluntarily, we're talking about really, really gravely disabled. That's a problem, right? Mm-hmm. Because if we can't, if that's the criteria, then what we're doing is intentionally making people sicker in order to begin a treatment that could have helped. We could have helped the person avoid that advanced deterioration if we recognized that they
One of the things that you said that's so true is that, like, when people think psychosis, they think grossly disorganized, but that's not, like, I have plenty of patients that are still having some psychotic symptoms that are like out working and in school. Like, there's a spectrum, like in that, you know, the average duration of untreated psychosis in this country is 1.5 years, which is just horrible. It's unacceptable. But that whole 1.5 years that it's happening, like, it's psychosis. It's not psychosis leading to not being able to take care of myself or speak in incoherent sentences, right? Which usually lands people in the hospital. And like, one of our biggest goal is that no one has to go to the hospital. Like, you should not have to go to the hospital for your first episode of psychosis.
Right.
Like it should have been identified earlier so that you can come in my office, come in your therapist's office, have a chat about it, and start feeling better in whatever way that works for you. Like, it should not be that you have to get that ill
Absolutely.
before anybody like does anything about it. It's so sad.
And you're an example of what education and early diagnosis can do. Because if you know what you have, we normalize what you have. This is my diagnosis. It's like diabetes. I'm taking my medication. I'm educated on what my illness is, and then I'm dealing with it, right?
Exactly. I think about that all the time because I have a lot of family members. My father and my uncle, they have schizophrenia and bipolar disorder, and they're unmedicated, and I've seen the effects of that on their relationships with other people, on their relationships with themselves and the world around them. And it's very much a cautionary tale. And as soon as I got diagnosed, I was like, okay, let's figure this out. Let's work on this. Let's take medication. Let's go to therapy every week. Let's do everything I should do to really try to keep it under control and keep myself in a healthy place.
Yeah, you brought up medication. I think a lot of times people also misunderstand what medication does for a person who has a mental health diagnosis. I think, again, we are so used to and prone to going to the doctor, getting a medication dosage for maybe like 14 days. And after I take my medicine for 2 weeks, I'm finished and I'm healthy and I'm healed. So then when you get medication to treat your mental illness and you start feeling better within that 1 or 2 weeks, or, after it settle in, it's like, okay, I'm good. And then you're back off the medication again because of the lack of education surrounding it, or even the lack of education in the community. And you feel better for those 1 or 2 days, and then you think everything is all good, and then you re-experiencing these problems all over again. And you might go to the therapist and they might encourage it, but oh well, I'm doing well. I'm good, because again, that stigma that's placed on there, but so much around the lack of education, like within our communities, around psychosis and mental illness, it prevents a lot of people from getting the help that they need and becoming well and being still high functioning, whether they're taking the medicine, but like with therapy or just exploring other things that can be the outlet that can be very supportive. And we don't have a lot of preventative measures ahead of time, like with your situation, being that you were in school and you learned of your diagnosis, but even being observed by counselors in school or social workers in school, you go underneath the radar because your school may have 500 to 700 kids, and you only have one school counselor and one school social worker, and you miss so many things. And you would think that the people that are there to be the ones to catch this early on and to be able to support the parents with identifying that they're overwhelmed with the amount of kids they have to service, that it goes under the radar. And your mom and family, like you say, with your dad wasn't taking his medicine, they're uneducated about these things. So as much as they would like to support their children, I don't think parents are trying to always avoid it, but they don't know what to do or what is going on or how to do it. And here you have the professionals within the school setting who my child is around 6-7 hours a day, and because there's so many of them, it still go undetected or unsupported.
Something I've noticed about the people in my life with psychosis, that I think because it was caught later on in their life, like near their late 30s to 40s, they have already learned to live with it, whether or not it's healthy. And so hearing someone say how you're living life is not correct and you need to take medication, they just do not believe it.
Right.
And it's not something they can comprehend or understand, and so they refuse to take medication. And then also, as someone with a psychosis disorder, I find it hard to take medication because it's really easy to take medication consistently and then be like, oh my God, I'm doing so good, I'm happy, isn't that awesome? And then you're like, I don't need medicine. It's like, okay, yes you do. That's why I actually switched to the shot, so that I couldn't give myself the chance to say no to taking medicine.
I remember when I first started taking medicine for depression, And you know, your way of normally function. I was a crybaby. I'm always crying. I'm always in my feelings. I'm always emotional. I couldn't cry. And I was like, something is wrong. When I started taking the medicine, I'm not crying. And I thought something was wrong because I couldn't cry. Because I was so used to living and functioning as the crybaby, the one that would be in the room crying for no reason, the one crying to our environment for no reason, just wanting to shut myself off. And like you say, I was functioning like that for a long time. I've been surviving like that. So when I couldn't cry, I thought something was wrong with the medicine, not nothing that was wrong with me, you know? Yeah.
But I think with just what you said and just what you said about it running in families.
Right.
So you know, just like diabetes and high blood pressure, it runs in families.
Right.
And so for families to be educated about the fact this is something that runs in our family, and to educate your kids about it.
Right.
To educate them about signs and symptoms and what it means, and normalizing it is so important.
Well, I think also, and I'm interested in, well, all of everything that everybody's saying, but there are studies that show that about 50% of people with schizophrenia and bipolar disorder lack insight that they have a serious mental illness, and there's also some evidence to suggest that it's the illness that itself that is taking away the person's insight, which is a cruel irony. And then so they don't know. It's like a not knowing. It's not a denial. It's a literal not knowing that there is anything wrong, and it's incredibly difficult to try to get somebody to take medication for an illness they don't think they have.
Right.
It's like any of us taking insulin for diabetes when we know we don't have diabetes, even though if we did have diabetes and not take medication, we all know what the consequences would be.
Right.
And I think that's the most difficult population that we deal with, and that we see. I partnered with a judge here to start a court program that specifically addresses that issue, which is assisted outpatient treatment. It's civil outpatient treatment, it's not a criminal court, where we can work with that individual and their doctor and their family, the whole treatment team come together to assist that individual to help them stay, treatment compliant. And I mean, those are hard words, but to help them stay in treatment and then ensure that they're getting the services that they deserve, even if their insight never comes back.
But that's very helpful, because I did assistant outpatient treatment like 100 years ago. But when we did it, just having that judge talk to that person once a month or once every other week was so helpful. And knowing that they had the support that they needed was so helpful. So if they were being strongly encouraged, it was like, oh, I know I'm going to have to talk to that judge next week, or I better take my medicine.
Right.
And they would,
Right. That extra motivation can be really helpful.
It's really good motivation. And the judges, if you pick the right judge, which you did, can be so comforting and supportive, but yet still have that authority.
With psychosis, though, and I think that this is where the education about the experience itself, the experience is someone's reality. So how can you say one doesn't have insight? Because that's their reality they're experiencing. So I think that we, without psychosis, try to sort of conceptualize this, if it's schizophrenia, that somebody doesn't have insight. But what we're gaining research information historically been is a population of people that never had good care. So how do you even know that schizophrenia has, typically a lack of insight? Well, it's you never even gave them a chance to gain insight. And by the time they start working with someone, they're 20 years in, and it's not healthy for your brain. And so you're 20 years into a very,
and that's the spectrum, right? So so we don't want people to have to get that far gone if there are ways we can intervene earlier, which is what early episode psychosis is all about, and why there should be more support for that. I think you're always going to have certain cases, but we want to change the percentages so the majority of people are getting help early, and it's the minority that are kind of needing more, help for more advanced psychosis rather than the other way. Right now, it's the other way around.
Right.
It's like a minority of people are getting early episode
Right.
help, and then the majority of people are ending up in and out of this hospital situation that doesn't work.
Do you think there's a dilemma about whether or not doctors and psychiatrists want to diagnose folks really early on, so that they give them other diagnoses such as ADHD and OCD?
Yeah, well, I think how someone, like, what is going on with each individual before you can actually say psychosis is present is this like constellation of what is like the latest papers, like there's 130 sort of symptoms of a clinical high risk state. And it's like they're all overlapping. So it could just look like all these other things. Do a bunch of people actually, is there an increased risk of having ADHD in your history? Yes. Could that ADHD clinical picture actually be sort of like the cognitive changes that happening very, very early on in emerging schizophrenia? Maybe. But we're never going to know that because we're not doing like fMRI imaging every single solitary here so that we can like see what this looks like. But there is the dilemma because of stigma, and I'm teaching the medical students right now about everything psychiatry, and primary care doctors are reluctant to refer to psychiatry because they don't want the individual to feel like labeled. They don't want to tell the family to refer someone because they're worried that the family's going to feel judged. Then they're worried that the psychiatrist is going to give an inaccurate label and that might perpetuate stigma. So there's like all of these layers of stigma. And you're not saying, I want to give you a diagnosis early. It's like, I want to know what is changing for you that most of my patients are like, yeah, this isn't cool. I don't like this. Like this is going on with me. I'm like, I have no idea really what it is. Right. I know that there's part of you that, like, where you're feeling your reality is shifting and no one else is sharing that experience with you. And that's a problem for you. And they will be most often are like, yeah, when you get down to it, like this is the part that's becoming a problem with me. Whether or not in these very early phases of treatment, we're usually in an unspecified psychotic disorder for a while before it kind of all plays out, and then we retrospectively understand what was going on before, and then being comfortable with like not knowing.
Yeah, and that's where it's hard. I think for everyone, it's hard for parents, it's hard for the kiddos, and I think in some cases it's hard for the caregivers or the providers. But I think one where we're seeing some success, and this is where hopefully the tables get flipped, and that we see more people early intervention and less in AOT, is that we're getting clinical high risk kids referred to our clinic, the early psychosis intervention clinic, for assessment. And so, if you had come at 10 and you reported these trains that you were hearing, right, in the context of having a family history, we would have noted these things, and then we would have monitored you over time, and in a perfect world, we would have been able to catch things before they got to the point where you needed to be hospitalized, and we could have gotten you into the treatment you needed to then, move on with your trajectory.
Something you mentioned was educating families, and I think that's really important because that's how I knew that I had schizophrenia, is because I remember when we first sent my dad to the hospital, my mom sat me down with my 5 siblings, and she was like, guys, if you ever are in this position, promise that you'll take your medicine. And we were like, okay, we promise. And I think as soon as I had a really reality shifting episode, and I was like, okay, what is this? And I was like, well, my family has schizophrenia, and so I think it's schizophrenia, and I think I should seek help immediately before it goes anywhere else where I don't want it to be. But I think educating families that already have people in the family that have psychosis is really important, because then it would help other people catch it. they start noticing symptoms in themselves.
I just think about a lot of kids that I've worked with who don't know their family history because the lack of parents not even being present in many cases. And so with knowing the history and observing some things, and maybe you could put a label on it because it's relatable and it's a relatable experience, it's one thing. But I was just curious, like, what would it look like to have like an educational class in school, to have like, you know, mental awareness education class.
All in the pipeline.
Yes, actually.
And it doesn't have to, because you know now they're introducing coping skills as early as kindergarten and pre-K, like how to do deep breathing, how to suicide awareness and stuff. But just like even like an educational course, because we have finances, because it's important to manage your finances and everything. But what about my mental health? You know, like just to have like a course, like you have to take it for a semester, or you like to even introducing it early as middle school, because it can be preventative. Like I'm thinking, you know, like if you would have took that class in 8th grade, you probably could have named it much sooner than when you were 16 years old. Like, oh, this is what I'm experiencing, this is what I'm understanding, or this is my brother experiencing. You know, not to do like I was doing overboard, like diagnosing everybody, but just to, you know,
awareness.
Awareness of your own family history. And I mean, honestly, that is the conversation with almost every referral I get, where I'm saying, you know, someone's saying with my loved one and so on, and I'm like, do you know if there's any history of serious mental illness in your family? And almost always they're like, yes, my mother, my brother,
Here everybody is bipolar, schizophrenic.
Yeah.
And when
And
somebody,
how much,
which is not,
that's true, and how much of that is, the way the system works, and of course we deal mostly with acute situations, we're not allowing doctors the flexibility to long-term diagnose, right? And so everything has to be right now, right here, because this is what's reimbursable, this is not reimbursable.
I think I have the luxury of working with some pretty amazing physicians and psychiatrists, and you know, the evaluation and assessment period are a long period of time. I'm also child trained, so we're like super conservative and like take our time doing everything. But there's like what in the inpatient setting is where I think that is truly a pressure cooker, and that burns out a lot of doctors, where you're not able to really do what you want to do. Like that someone has to want to kill themselves or kill someone else to get a bed day. And I was like, what about someone that's like hearing demons telling them that they're gonna like come kill them? Like that doesn't qualify? Like, are you kidding? Like, or you know, you're so catatonic that like you're not eating and drinking, and I'm about to have to put you in the ICU. Like that's what it's got to get to. Like that's ridiculous. And with, you know, you mentioned diabetes several times, and I think making comparisons, and you know, like our community should be outraged. It's like you would never ever, like we track hemoglobin A1C specifically for early identification of a blood sugar situation, and that gives you an indication of the last 3 months. So we are so concerned about looking at your average blood sugar for the last 3 months, and if it tips the scale, you automatically are getting early intervention. And no one would ever say, okay, we'll give you a couple really good years of endocrinology visits for your diabetes, and then goodbye. Then figure out what to do with your insulin. Everybody, people be outraged. Like it's just, and so, you know, with early intervention programs, like we're one of the only ones that I know that don't discharge after 2 to 3 years.
Right.
We keep people because they need the support, and they keep coming back because clearly the support is working and they feel safe.
So, yeah, and I work with ACT teams, the sort of community treatment teams that, and there's, you know, the different companies and they have different kinds of setups, but they're all saying now that the insurance companies are not allowing their clients to stay in treatment if they haven't had a hospitalization in the last 6 months. So, and the ACT teams are arguing, this is intent for those that might not know, so it's in intensive outpatient teams that will come to the house, and it consists of therapists, social workers, psychiatrists, vocational specialists, and so on. And so, and the ACT team's arguing that the reason this person hasn't had a hospitalization in the last 6 months is because they are getting the care, the level of care that meets their need. And if you deny us to be able to help this individual, they will become hospitalized, in which case what we're doing is forcing harm on people. This is, it's man-made manufacturing of harm. And our whole credo should be do no harm.
Right.
So it's the way that the insurance companies is totally antithetical to care.
Well, and the model, because the ACT model is a long-term model.
Right.
And so the original ACT model was once a client, always a client.
Right.
They stayed with you throughout the duration of their illness.
Medicaid reimbursement.
And so now
Should be Medicare,
Medicaid,
too.
well, when we first started ACT in New Orleans, it was a contract with the state.
Yeah. So
we
any
had
reimbursement.
90 days to engage, which means, like we had 90 days to, gain that person's trust and build rapport, and then we could keep them forever.
Right.
And now the insurance companies have redefined the model.
Right.
And, now they just have this circular kind of system that they have going. That
This is
feeds-
just lack of reciprocity and lack of seeing mental health care as part of health care. So, I mean, I don't think it's insurance companies. I think it's like our country at large.
Yeah.
This is like
Blatant
issue.
discrimination. It's discrimination. It
Yeah.
is blatant discrimination, and it probably grounds for a class action lawsuit if somebody were interested in doing it. But try to find yourself a mental health a law attorney. There's no money.
Right. But I think we've talked, everyone has mentioned these systems that are not working for these patients that we want to serve. And our early intervention, early detection campaign is an attempt to address these system issues through education and early intervention. And one of our fantasies is that we get these different systems in which people with high risk exist to interact with one another. So wouldn't it be amazing if there was a mother who has a child and there's a family history of schizophrenia that gets noted in the baby's chart at birth, and that gets tracked over time, and then the education system gets alerted of that. So when that kid goes in school, the counselor can be aware that this child has a history and can be observant of potentially symptoms that might arise at an early age, and then get people into specialized care early on. But our systems work in silos, they don't speak to each other, and this is where we end up with more people in AOT than having early intervention.
Right.
But
Trauma comes in.
That's where the trauma comes in, at least for me and my family. I feel like if there was education and awareness earlier, I wouldn't have a sibling in prison who was diagnosed with ADHD when he was like 8 years old, but he was hearing noises and hearing voices, and he had command hallucinations because nobody really thought to ask about our familial history and how it goes back on one of our caregivers' side, back 3 generations. The only thing that they would ever talk about is, I'm not sure how old this is in New Orleans, but they would end up down here on the 3rd floor. They would end up on the 3rd floor. Or in Mandeville. Yeah, and so they would make their rounds, and there was this revolving door of pills and hospital visits because there wasn't that education and there wasn't that awareness. And even on the opposite side of that, the male caregiver, his went back a generation. And then eventually there were voices who would tell him to do things to people. And then that's where a lot of the trauma comes in, because we did not have that education. We did not have that awareness. Thank God we were able to survive and we were resilient, but I just think about how that is not just in our family, but nationally. What does that look like for people growing up with caregivers who are not diagnosed and treated, really treated early enough? What does that look like for them?
Yes. I would like to talk. I mean, the biological family history is like so real, and I remind people all the time about the biological risk, like that there's nothing in this diagnosis that is a fault of somebody, or because you experienced one stressor or one trauma. Like, that's not how schizophrenia is. It's a biologically driven illness. There are, and it affects all parts of your body, parts of your body, not just, your mind. But when we do have, like, in our community, a lot of people, if you're just angry easily, you're bipolar schizophrenic. Mm-hmm. So I get that all the time when I'm asking about family history, and when people say that, I'm like, wait, okay, let's really talk about that. Like, so you say my mom's bipolar schizophrenic, like, what happens with her? Like, oh, she just gets, like, upset and, like, yells and screams. I'm like, does she go to the hospital? And they're like, no. I'm like, does she take medication? No. Has she ever been prescribed medication? Has she ever been in counseling? Has she ever been in the hospital? Like, try to see, like, legitimately, like, is this a serious mental illness, or just this, like, term we throw around because someone's acting crazy? And, like, to try to understand, like, true family history versus, like, just, it's wild how we just use these words and they don't really.
But I think it's also, like we were saying, don't know the family history. Because I think about with my own case, like, my father was addicted to drugs for, I think he still is, I don't know. But, just him coping with that. And I don't know if he was diagnosed with anything to, for him to want to use drugs to cope with whatever he's dealing with, or to self-medicate with drugs. And because of the lack of education, I don't even know if he knows what he was dealing with. And like I said, I've always gone, it's the hindsight moments for me, because, like, I remember being a little girl and my mom came to my school when I was in the 5th grade and was like, I'm leaving and moving to Florida. And okay, so we're moving to Florida? No, I'm leaving. And, came to my class, like, in the middle of school, not even understanding the trauma that I'm experiencing, because it's like, now what do I do with, so you're leaving and I can't come, and you're going to Florida, you're not going on a trip, you're moving. And it's like, I'm left to process that. And I think people always think about just the history, but the trauma that triggers, psychosis, and it doesn't have to be, hereditary. However, what I began to learn is, like, depression is passed down. And I think, maybe my mom was experiencing depression. She was a young mom. She was a teen mom. She was 18 years old when she had me, 19 when she had my sister. And, not to put all her business out, but, and then she had another child. She had just had this baby. My little sister is a baby. And she decided to leave. So now I'm processing things. Is like, I know I went through postpartum, and I was like, what if she was experiencing that? And her moving to Florida was her escape, her coping, her trying to figure this out. If I can leave these problems here, maybe I was a problem, maybe I wasn't, but if I can leave that there, maybe I can go find peace somewhere else. Or maybe not realizing that was being taken with her. Like, I remember visiting and still, getting fussed at. And I remember, you didn't have the peace that you thought or whatever, because you didn't deal with it accordingly. You were trying to escape it. And again, these are hindsight moments. This, as I got older, this is as I started dealing with my own issues and actually being educated and fortunate. I went to school and was able to get educated in this particular field to be able to address my own, problems that I was dealing with. It was like I was able for me to forgive them, because it became like this healing piece. It wasn't just healing of me getting a mental health treatment. It was like, I have to let some things go because they may have not known. And I think a lot of times people get these diagnoses because they're dealing with trauma. And I remember having these manic episodes and thinking, I was diagnosed with bipolar, but then my other doctor was like, you don't have bipolar. And it was like, well, which one do I have? Like, do I have it? Don't I have it? Like, what's going on with me? But again, we're consistently getting the help, consistently staying in treatment, applying the skills that I'm being taught and the techniques and stuff has really helped me overall. And I just wonder, like, had they been educated, had they got the help, had they known what was going on with them, would it have triggered down to me? Or, but some things are passed down, like, with schizophrenia is within the family history, but it could be detected and treated early if, caught then. But the lack of education, is preventing that.
And you two make such a good point about trauma running through families.
Oh,
Intergenerational trauma is real.
trauma beget trauma, but we can also beget healing. Like, I think we fail to realize that we can pass down healing just like we can pass down trauma. And how we respond and how our DNA is responding to that, and that's passed down from one generation to another generation. You know, like my mom was a teen mom. I was a teen mom. My daughter is 26 years old and she doesn't have any kids. You know, I was severely depressed. My mom was severely depressed. My daughter, I recognized it early enough to say, you know, is this depression? You know, fortunate for her case, it really wasn't, you know, just experiencing the teenage woos or whatever. But I was able to recognize that. I brought her to the doctor early on. I didn't feel the stigma that, you know, would have been placed on us from just like, let's go see what's going on with you, because I don't want you to deal with what I dealt with. I don't want you to go through life the way I went through life. I don't want you to feel like you're different and under this dark cloud. I want you to have a productive life. And again, that came with education. But
safety, and you're giving
yeah,
her a sense of safety.
Yeah.
To talk about things that are difficult to talk about. And you know, I think especially with psychotic symptoms, they're not, because it's such a like isolating in my own mind experience. It's really challenging to. I remember you were talking to my medical students one year about your experiences, and you were talking about how you like now will like check in with your friends and be like, yo, are you like hearing that? And they're like, no, and you're like, okay, you know, like that you feel safe. You feel safe in expressing things that are difficult to express, and that's so protective. And I guess the thing in common is this, like everybody has like their narrative, their life narrative, and you know, in my, you know, when I'm doing an evaluation and getting family history, it's not just like diagnosis. It's like, is there a chance that people just kind of want to hide that person though? Or like, is it something that your family, you've noticed, actually doesn't talk about? Like to try to understand the family culture and like maybe while I'm trying to understand to be like accurate in like identifying like a genetic history, but also identifying, is this a family that this isn't a safe topic, you know? And like, so then how am I going to educate this family in a way that's like on par with how they're used to hearing things? Like, it's going to be really difficult to hear.
Serious mental illness. It's a family problem, right?
Yeah.
It's a family problem, and unfortunately, I think it's addressed too often as, you know, families get shut out, and even families that are aware of their loved one's psychiatric history and the evolution of where they are in this particular moment. Like I've had families recently whose loved ones have been hospitalized, and they're calling and calling, that even if they can find out where their loved one is. So we're dealing with a lot of HIPAA barriers as well. But I have a family right now, and they're very concerned about their loved one. It's been suffering for 15 years, evident serious mental illness, been diagnosed, and they're calling the hospital. We need to tell you about her behavior, and they're saying to the family, well, I'm sorry, they haven't signed an ROI.
That's such a misinterpretation.
It really
But guess what? It's not only haven't signed an ROI, so I can't share information with you, even though this is an emergency situation.
If they were having a heart attack, you'd like
It would be
Correct. But guess what? Also, there's the hospital social workers are saying we can't listen to you
And
either.
That is
Absolutely not true. And so they're so the hospital is now doing their evaluation and diagnosing and confecting a treatment plan on what the psychotic person is
without all the
saying,
information.
Without all the information. And unless if you don't have that whole bit, that's why I love, one of the things I like about assisted outpatient treatment is we are able in our program, and it's rare because other programs around the country don't do AOT the way we mostly do AOT, which is where the family member is the petitioner, and when the doctor is the court-ordered psychiatrist is doing the evaluation, they're interviewing the client, the patient, respondent, but they're also interviewing the family, giving all of the collateral information so that when it comes time to come to court and have the hearing, everybody's hearing the same information together. And it makes, I mean, honestly, I have seen, families that never knew anything about what was going on with their loved one. Now they're in this program, and these relationships are being repaired. These family relationships are healing. Are healing.
Really good clinical care.
Yeah.
That's how it should be.
I wish that when if somebody either they voluntarily went to a hospital or they end up involuntarily going to a hospital, that they were met with you guys, this team. You met with this team, not met with
Right.
this sort of medical, sterile, clinical environment where you're dealing with people you've never seen before who are just doing their jobs. They're not really.
Well,
And you're also dealing with psychiatrists that are seeing 100 patients a day.
Right. Again, another systems issue.
I'm curious. I know you say y'all have a family history, your dad, and y'all all experienced and witnessed him being hospitalized and not taking medicine, and you are active in your care and treatment. Do you talk to your younger siblings or other siblings about your experience, what you're doing, like how medication is helping you and therapy? Like, how does that work in the family unit being that y'all?
Yeah, I think I am especially very open about it. Like when my little siblings come over, I'll talk to them because they'll, I get to hang out with their big sister at her house, and so we come over and we do that, and it always comes up because of course it's a big part of my life, and it's obviously there, and so they feel open and safe enough to ask questions about it, which I think is really important. And then I feel safe enough to tell them about it and share with them. And because it is also something that they may end up experiencing as they get older. And so I want them to be aware. Another thing, though, is I think with catching psychosis really early is not just making sure the whole family is aware, but making sure that people feel safe, I think, is a big thing, because experiencing psychosis is a truly terrifying thing. It is very scary because your whole reality is shifting and you don't know what's real and you don't know what's not real, and then you feel crazy, you feel insane, and you don't want to tell anyone because you don't want to. It's so personal and emotional, and it is really scary. And so the safer people feel, the more open they're going to feel about talking about it and sharing with someone that they don't feel safe and that they don't feel safe in their reality. I think that's really important.
Thank you. It's been an ongoing theme of this conversation. It's been safety.
Safety, education, and healing. And I wish we could continue this conversation for hours and hours, but we do need to wrap up. I just wanted to thank all of you for coming together today and having this, for talking so much about your personal experiences. And I think part of our goal is to continue this conversation with other community members, encouraging you all to go out and have these conversations with more people, and asking that the viewers, if you're inspired by this conversation, that you share this link with 3 people in your community, and that you listen carefully and refer people early to treatment so that they can get the help that they deserve.
Thank you.
Thank you.
Thank you. Yes.